Hi, this is Aaron Cook, physical therapist here at Physical Therapy Balance Center in Menor. We're here today for our Help Yourself learning series. What we're doing today is we're going to be talking about vertigo, specifically benign paroxysmal positional vertigo, or BPPV for short. Many people talk about vertigo. Vertigo is a symptom. It's like diagnosing somebody with pain. Anytime somebody has vertigo, we have to figure out what's actually causing that vertigo. So I want to teach you today how to diagnose this BPPV to see if that's what problem you have. I'll show you how to test for it at home, screen out a couple of serious things, and give you some resources on where to go if you find that you have a positive test result. So at this point, you're probably wondering, what the heck is that on his head? So this is my model for BPPV, complements of vestibular first. I say complements, I don't know why I say complements, they didn't pay for me, I paid for it. But what this is a model of part of your inner ear called the semicircular canal. And if you look really closely, you'll notice these little different colored crystals. So what these are something called otoconia. It's a naturally occurring part of your body, kind of forms on part of your inner ear at birth. Think of like a cave, think of a stalactite and a stalagmite. And every so often, for a couple of different reasons, usually due to old age, trauma, inner ear infection, or mostly just spontaneous, sometimes these crystals will fall off and get where they're not supposed to. As physical therapists, we're trained to help do something called a repositioning maneuver, where we can help coax these crystals back where they're supposed to go so that they'll dissolve and they won't cause symptoms anymore. You can kind of see through here as if these things were kind of swirling around, that classic vertigo that people are talking about. Now, BPPV, most commonly, compared to other types of disease, will be classic room spinning vertigo. It's going to be really intense for a short period of time, generally about 30 seconds, 60 seconds, sometimes a minute or two, in rare cases a little bit longer, but it usually goes away on its own within a couple of minutes. If this is something that you have and it's constant, this is likely not BPPV, and that would be a good reason to go see your doctor. Um, for BPPV itself, let's go through how to test for it. So what I'm going to do is, before we do the actual test for it, we have to check for another problem. We have to check for clogging of the artery in the neck. They teach us to do this before we go through the testing procedure, because this position requires a lot of neck rotation. And some people, as they get older, they can get arthritis, stenosis, and that can kind of pinch the artery if you really go into that full neck rotation for too long. So we want to check that first. So how you would do this at home is you would come forward on your hands with your hands on your knees, and then you're going to turn all the way to one side. When you turn all the way to one side, try counting out loud to about 10. So I'll actually have people, it's important to count it out loud. One of the signs of a positive test would be as if you're holding this position, if you start slurring your speech, if you start seeing double vision, if you start passing out, anything like that, that would be a sign to call your doctor. And that would be a sign that this is not BPPV. For BPPV itself, you would want to do this both sides. If that's good, now we can do the full test. So this is what's called the Dix-Hallpike procedure or maneuver. So how you would do this at home is you would set up on the edge of your bed, maybe a couch. You can do it one of two ways. You can either lay with your head off the edge of your bed, or you can do a stack of pillows and lean off the edge of the pillows. If you have poor neck mobility, doing it on pillows may be a little safer for you. But what you would do is you would set up on the edge of your bed here. You're going to turn your head about halfway, about 45 degrees. And then when you're ready, you're going to lay back with your head off the edge of the bed, really leaning back all the way. And you want to try and maintain that rotation of the neck. And you want to try holding that for about 30 seconds. And you're going to do it on both sides. You're going to do it on the right and on the left. So let's walk through what that's going to look like. So I'll put my model back on. What we'll do is we'll come here about 45 degrees, count to 3, we'll lay down, 1, 2, 3, and you're trying to hold this position. It's generally not a comfortable position for most people, And what you're doing when you're here is you're listening to your body. You're listening for symptoms. Are you feeling dizzy? Are you feeling nauseous? Is the room spinning? These would be the kind of things that you're looking for. So after 30 seconds of that, you would do the other side. I usually recommend giving people a minute or two, because if you've been in that position for long enough, it may be a little uncomfortable, even if you don't have this position, or this positional vertigo rather. So if you do that and you notice that classic room spinning dizziness lasting about 30 to 60 seconds, congratulations, that's a sign that you most likely have this BPPV. If you find that, we recommend either consulting with your doctor or a local physical therapist that's trained in management of vestibular issues, or vestibular meaning inner ear. So we hope that was helpful. Always consult your doctor before anything else, but hopefully that helps.